Welcome to Data Driven Health RX. I'm Miguel Rosa. I'm a nurse practitioner entrepreneur, endurance athlete, founder of a small integrative health practice called Blue Zone Health and Wellness, and I'm someone who believes that your health data should work for you. So on this podcast, we're diving into wearable health tech, metabolic health, hormonal health, performance and longevity, and I'm going to be sharing a behind-the-scenes look at what it's like to build a cash-based practice while balancing a clinical career and training for a major triathlon event. Whether you're a patient, athlete, or a fellow healthcare provider, or just someone who wants to feel their best, stick around. This might be for you. Important topic of discussion before we dive in. Everything shared on this podcast is for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. As a nurse practitioner, my role here is to solely act as an educator, not your personal healthcare provider. Accessing this content does not create a patient-provider relationship between you, me, or Blue Zone Health and Wellness. Always consult with your personal healthcare provider for any medical decisions or before starting any treatments. Let's get to it. I tell my patients all the time that tracking your metrics gives you power. It gives you data. It shows you patterns and trends, and it helps you make informed decisions about your health. And I believe that wholeheartedly, but only if it's used correctly. However, when you let it consume you and you struggle with consistent tracking, there could be a feeling of defeat when you're not tracking. You feel like you should be putting in the work. When you know that you know what the right actions are, you're just not doing them. Woohoo! All right. Welcome to the very first episode of the Data Driven Health RX podcast. My name is Miguel. I'm your host. I'm a nurse practitioner and I'm an owner of a small practice here in Connecticut. It's an integrative health clinic called Blue Zone Health and Wellness. And before we dive into the first episode, I just want to give a shout out to everyone who's been following along on that journey since day one. I have a newsletter that I send out every couple of weeks, and you guys have been following along and from the beginning. And honestly, you guys are the OGs. You guys, I appreciate you taking the time out of your day to learn about what I've been building and everything up until this point. So thank you. And to all my pre-launch patients who trusted me enough to walk through my door, whether that was in person or virtual, the very first patients, thank you. I don't take that lightly. You know, healthcare is very personal. So I really appreciate you putting your trust in me and giving me the opportunity to improve my process before I open the doors up for more people. So let's get to this podcast, though. Who is this for? First, really anyone who's interested in metabolic health, how hormonal shifts can impact the way we function, the way we operate, or whether you're curious about wearable tech, health tech, and how we can implement it into our lives and into modern day healthcare. And second, for my healthcare providers, especially the nurse practitioners out there who are on this entrepreneurial struggle bus with me, you know, we can help each other out by sharing a little bit more about what we do in our own little corners. And maybe it'll inspire another nurse practitioner who's out there and wanting to, start their own gig and searching for the next podcast to listen to. I've been there. I've heard all of them. And I'm here to tell you that at some point you also have to jump. So a couple disclaimers. One thing you won't find here is me painting this perfect picture of myself, right? As this healthcare provider who's got it all figured out. Because that would be a lie. Don't be fooled by my killer Canva art skills or my headshots and my social media posts. I'm human. I struggle with a lot of the same stuff you do. The sleep, the diet, the nutrition, the exercise, the consistency, the motivation, I'm also here to tell you that no medication, no hormone, no supplement is going to fix you if you don't work on those things. The sleep, the nutrition, and I'm not even going to say exercise. I'm going to say movement, because daily mobility and stretching is just as important. especially as we age. And that's something that I really, really try to emphasize with my patients. I try to be relatable, not this pompous a-hole. I try to be realistic, set clear expectations, and let people know that change and changing our state of health, whatever that means for you, right? That's individualized. It doesn't happen overnight. It takes time. It takes consistency, effort, right? So I've built this practice in a way that I would like for myself, honestly. I've built a concierge style model where people can check in with me as needed, where it's actually normal to check in, right? I want to hear from you, where we start to look at things outside of medications and figure out if there's anything else, anything within my purview that I can do to figure out what's going on, to figure out a possible root cause. With that being said, I'm also not afraid to prescribe a medication if I need to. Somebody had asked me, are you this holistic guru? Like, honestly, I just don't like to prescribe medications if I don't have to. When I do, I hope that it's temporary. And I hope that there's other things that we can work on. But obviously, that doesn't hold true in all cases either. Every case is different. But sleep, diet, movement, nutrition, that's the core component to every single treatment plan with me. It's going to be customizable per your needs, but it's guaranteed to be there. And then from that point on, it's up to you. It's up to the patient. So I'll be here when you need me. I'm not going to hound you. I'll reach out monthly or as needed per your individualized plan and patient agreement. But I'm here when you need me. And with that being said, for me to be involved in the care, it takes some level of participation on the patient's part. And it's very important that I gather as much data, both subjective and objective. Subjective is the data that you tell me how you're feeling, your symptoms, your experiences, things that you can't really put a number on, things that you can't measure. Objective data, on the other hand, those are things that I can actually, quantify, things that I can measure, things like your lab values, your vital signs, how they're trending, and, tracking different data points. So this is where the tracking comes in. But before I get into tracking and some other things that I'm interested in, I just need to address something head on. Because the number one question from the beginning for months that I've gotten was whether I accept insurance. So I appreciate that question because, that's the model that we're accustomed to. But I'd like to talk about why I have chosen to be a cash-based practice and not accept insurance. I want to be transparent about it because the answer affects both you as a patient or a potential patient and my fellow healthcare providers who are considering this model. So here's the insurance reality. Okay. Here's the truth about practicing within the insurance system. It's broken. Not because insurance itself is inherently bad, right? Because the way that it's structured makes it nearly impossible to practice the kind of medicine that I want to practice. And the kind of medicine that actually moves the needle on metabolic health and longevity. When you're an insurance-based provider, you typically have about 15 minutes, right? 15 minutes per patient visit, if you're lucky. All right, sometimes 20 if you're lucky. In that time, you need to review the chart, the last visit note, maybe the one before that. You need to look at any recent imaging, any recent consults. You need to look at all of that stuff so that you know what you're walking into. You need to go in and you need to address their concerns which sometimes is not the same concern that you need to address, right? So it takes a little bit more time. You need to do a physical exam. That's the quickest thing. That takes minutes, depending on what we're evaluating, obviously. But generally speaking, that's the quickest part. And then once you're done, the patient leaves. You need to document everything for billing, create the treatment plan, right? It's nearly impossible. Let me tell you what that looks like in reality. Even though you know, you guys, you know, you can't dive into someone's diet. There's no way you're talking about sleep patterns and stress level and how it's affecting their metabolic health, not all in the same visit. You might have them come back and, talk about little bits and pieces here and there, but you definitely can't spend the time educating how to interpret data and, how to use different tools and coaching them for longevity. You're constantly in that model, you're constantly in reactive mode. I don't ever recall being in preventive mode, ever. And here's the kicker. The insurance companies, they dictate what they pay for, as you're very well aware if you're listening to this. I don't need to tell you that. You want to put a non-diabetic patient on a continuous glucose monitor to optimize their health? Yeah, no, that's not happening. They pay for the diabetic patients only. And even still, there's a lot of, criteria that goes around that. Because just being a diabetic doesn't qualify you for a CGM. You want to run a hormone panel, a comprehensive hormone panel with, your free testosterone, your estradiol, your DHEA, and your SHBG, and to actually know what's going on. Yeah, that's not getting approved. So, that's why I chose this. You want to spend an hour with a patient doing metabolic counseling? No. You get reimbursed for a 15-minute visit regardless. It doesn't matter. So going cash-based gave me something invaluable. Personally, I think it's invaluable both to me and my patients. It's the time. It's the time with my patients. When I see a patient at Blue Zone Health and Wellness, I'm not watching the clock. I'm not counting down from 15 minutes. I can spend an hour, if that's what it takes, to really understand what's going on. And not sometimes, most of the time, there's no way that I can even understand it in an hour. Let's be real. There's a lot to talk about, especially when we're talking about root causes. So this way, I can practice preventative medicine the way that it should be practiced. I can implement tools like a continuous glucose monitor for metabolic optimization before diabetes kicks in. I can order the labs that I know that I need, not the ones that insurance will cover. I spend the time to really understand the health picture. That's the difference. That's the difference. So if you're questioning, why is this guy going cash-based? That's why. I'm not waiting for hormone levels to be clinically low by insurance standards, because I'm optimizing them for quality of life and for longevity. This is the kind of medicine that changes outcomes, but it doesn't fit into the insurance reimbursement model. That's the problem. So if you look at the HRT clinics, the hormone replacement clinics, if you look at the functional medicine clinics, the integrative health clinics, the longevity clinics, you notice most of them are cash-based. And it's not because we're trying to be exclusive or just make more money. It's because this type of medicine literally cannot be practiced well within the insurance constraints within that model. Think about hormone optimization. Insurance will cover testosterone replacement if you're clinically hypogonadal. So that's usually defined as testosterone below 300 nanograms per deciliter. So, okay, you're 35 years old. You're at 400 nanograms per deciliter. You feel terrible. You've got brain fog, low libido. That's not happening. ED. You can't build muscle. You're developing metabolic issues. Insurance says you're normal, but you're not optimal, and optimal matters for longevity. Same with integrative health approaches. Want to address gut health as it relates to inflammation. You want to use targeted supplementation based on micronutrient testing. You can't do that with insurance. It's not happening. None of that fits into the NEAT insurance billing codes. So practitioners who are serious about this type of medicine, we have two choices. We either stay in the insurance system and practice watered-down, reactive-based medicine, or you can choose to go cash-based and, really do the work and the things that can change lives. So I know what you might be thinking. Miguel, that's great for you, right? But what about the people that can't afford cash-based healthcare? Well, especially nowadays, right? That's a legitimate concern. And I won't pretend that, cash-based care is accessible to everyone because I know it's not. But here's what I will say. First, what we're doing is often more cost-effective than you think, right? You're paying out of pocket for your visits and services, but it's often preventing the expensive chronic diseases that are going to cost way more down the line. The diabetic medications, the cardiac interventions, the joint replacements, the hip replacement, all because of metabolic syndrome that could have been prevented. Not all, but, has a huge impact on how we live our lives is what I'm trying to get at. Second, I try to be strategic about what's ordered and what's recommended. I'm not ordering every single test under the sun just because I can, right? Somebody can come in with a whole list of tests and things. I'm using my clinical judgment to order what will actually inform the decisions, the treatment, the plan. And using things like a continuous glucose monitor, while it's not cheap, it's time limited. You're not using it forever. You wear it, you learn, you implement the plan, and you're done. You move on. If you want to. Some people use it long term. But I also need to be honest, this model is not for everyone. That's okay. If you need insurance-based care, and some people need insurance-based care, there's good providers out there that are working within that system. They're doing the best they can. I know they are. I've worked with them. I've worked alongside them. What I'm offering is different. It's for people who want to be proactive about their health and willing to invest in prevention and optimization. I like to look at all insurance the same. Auto insurance covers car accidents. Home insurance covers disasters, right? Hurricanes. They're not paying for your oil change or your snow plowing when it snows, right? Health insurance is the same. It's essential. It covers emergencies. The maintenance and the prevention, unfortunately, not so much. But we expect more as consumers out of our health insurance, which is really interesting. So if you're a healthcare provider listening to this and you're thinking about this model, let me tell you, it's incredibly fulfilling and you get to practice the way you see fit. You get to see outcomes that actually matter. You get to build real relationships with patients versus in and out. It's scary to leave the insurance model. Hell yeah, it is. There's a financial risk. Yep. Do you have to learn the business skills they didn't teach you in school? Yep. I never thought I'd be a podcaster a graphic designer, a CFO, a COO, a CEO. You know, I'm a one-man show, and I'm creating this practice and building this model in the best way that I see fit, both for me and for my patients. The alternative is staying in a system that's completely burning me out. And I know all my healthcare providers can relate. When you can't practice good medicine, and when you're seeing 20 to 30 patients a day, making no significant impact on the majority of patients you see, you're just trying to stay afloat and get out at a reasonable time. And if you're grinding and wondering if this is possible, let me reaffirm it's possible. You just have to take the jump. I chose cash-based medicine because I wanted to practice real medicine. I wanted time with my patients. I wanted the freedom to use the tools for metabolic optimization. I wanted to focus on prevention and wellness, not just sick care. I was tired of writing the prescriptions for the blood pressure, the diabetes, the hyperlipidemia, the regulars. I have no problem writing them. I have no problem. But the goal is to get off of them, and that wasn't happening. I wasn't seeing it. It wasn't the patient's fault, right? It's a healthcare system. On average, I believe the statistic was something like the amount of time that is spent in your PCP's exam room is something like 8 to 15 minutes. That's the amount of time that your healthcare provider spends on average in the United States in a primary care setting. That's insane, right? That's insane, especially if you're only seeing them once a year. Come on. So, is it the right model for every provider or every patient? No. But what I'm trying to accomplish at Blue Zone Health and Wellness, helping people optimize their metabolic health and expand their lifespan, for me, it's the only model that makes sense. So now that you understand why I've built my practice this way, let me be real with you about something that I ask my patients to do all the time. I like them to track. I've sent out a newsletter on this. I talk to patients a lot about tracking things like food, exercise, steps, sleep. And it's honestly, it's whatever their goal is. It's whatever, the goal is for them. It's not up to me. But here's the truth you need to hear. Tracking is hard. It's time consuming. It can become mentally exhausting when you stop seeing it as a tool and start seeing it just like one more thing that you're failing at. Right? I tell my patients all the time that tracking your metrics gives you power. It gives you data. It shows you patterns and trends, and it helps you make informed decisions about your health. And I believe that wholeheartedly, but only if it's used correctly. However, when you let it consume you and you struggle with consistent tracking, there could be a feeling of defeat when you're not tracking, when you feel like you should be putting in the work, when you know that you know what the right actions are, you're just not doing them. And here's what happens next. It can have an impact on mental health. You start to question yourself. But here's the thing. We just need to be patient with ourselves. We need to meet ourselves where we are, not our future selves, not our past selves, right here, right now self. All right, everyone. That's it for today's episode. Thank you so much for hanging out with me up until the end. If you enjoyed this conversation, do me a quick favor. Hit that follow button, hit the subscribe button. Whether you're listening on YouTube or on Spotify, it doesn't matter. Also, I'd really like to hear from you. So just leave me a comment down in the show notes or in the YouTube comments. Tell me what resonated. What do you want more of? What questions do you want answered next? Let me know. And if something from today's conversation sparked a thought, feel free to email me. You can email me directly at Miguel@datadrivenhealthrx. There is no dash in that email. Just note datadrivenhealthrx, all one word. Oh, and if you're listening while driving, just make sure you're not trying to type or comment right now. Okay? Safety first. Thanks again, guys. Thanks for being here. Be well. I'll see you next time.